It's a health emergency that has already killed 41 people in China, and tonight there's confirmation the coronavirus has reached Australia. As we go to air, there is one confirmed case in Melbourne, while in New South Wales there are 2 probable cases in Sydney, with another 5 people being tested. The virus might have also spread to Queensland. 2 people there are being tested, and another 4 cases in South Australia are yet to be confirmed. Authorities warn it's highly likely there'll be more cases, but say Australia is well prepared to deal with an outbreak.
Building a 1,000-bed hospital in Wuhan in just under a week to deal with China's coronavirus crisis. A health emergency that's now made its way to Australia, with our first confirmed case and almost certainly 2 more.
He was confirmed as positive after a series of tests earlier this morning.
The 50-year-old Chinese man flew into Australia last Sunday from Wuhan via Guangzhou on China Southern Airlines flight number CZ321, landing at 9:25 a.m. at Tullamarine Airport in Melbourne. The plane he arrived on, an A380, carries more than 500 people.
They will all be contacted and will be making arrangements to start making those calls from today.
Not knowing he was infected for 6 days, he spent his entire time in Melbourne at his family's home.
And are being closely monitored for any signs of illness.
2 men in New South Wales, one in his 30s and the other in his 50s, are in isolation in hospital with all the surefire signs of coronavirus.
And in one case, they had contact with a confirmed case of the disease in Wuhan.
They've been in contact with dozens of people since, and authorities just don't know how widespread this could become.
The Australian Government, of course, has been taking this issue incredibly seriously. We have activated all the necessary precautions and procedures.
A child taken to hospital in Sydney with signs of the virus, doctors and nurses in full protection gear, but he was cleared.
I wouldn't be surprised if we had further confirmed cases.
Coronavirus is a flu-like disease that can cause severe pneumonia. Symptoms can take up to 14 days to develop. There's no vaccine and antibiotics don't work either. When it comes to treatment, all doctors can do is make the patient feel comfortable and let their immune system try and fight it off.
Most of the fatalities in China have been older people with existing medical problems. 20 million people are now in lockdown, overcrowded hospitals with doctors in hazmat suits.
Do not travel to Hubei province at all.
In China, the virus has killed at least 41 people, with more than 1,000 confirmed cases and another 8,400 people under observation. And it's spreading to new continents, with confirmed cases in France, the US, South Korea, Japan, Thailand, Singapore, Vietnam, Taiwan and Nepal.
There may be some people who have been in Wuhan who got out before the travel ban was instituted by China.
Including on Thursday, the final flight direct from the epicentre of the disease came into Sydney from Wuhan. Face masks and some warning flyers, but really no idea who has it and who they could spread it to.
The risk really is in people who've come from that part of China. There is, at this stage, no risk to the general Australian community.
Chris O'Keefe, 9 News.
Reporter Mark Santomartino is in Melbourne tonight where the infected man is being treated. And Mark, we understand that man is in isolation.
Every precaution is being taken to protect staff and other patients. Georgie, yes, he is in isolation here in a negative pressure room. Masks, gloves and gowns are a must for anyone treating him or wanting to visit him after tests came back positive for the coronavirus at 2:15 this morning. Now, authorities say the man from China was showing no symptoms on the flight to Melbourne, which landed 6 days ago. They don't know if he was infectious at the time, but admit he could have potentially infected others on that flight. Now, he has largely been in isolation since. That is the good news. He's been staying with family. He hasn't been going to restaurants and he also hasn't been catching public transport. He's only left the house to go and visit his doctors. Now, concerningly, the first GP he went to visit misdiagnosed him. As a result, the health department is throwing extra resources at our infectious disease hotline here in the state. He's been here since yesterday in isolation. He's stable with pneumonia. Georgie?
All right, Mark, thank you for that. Let's go now to Emma Partridge, who's at Sydney's Royal North Shore Hospital for us. And Emma, what more can you tell us about these 2 probable cases in Sydney?
Well, Georgie, health officials are waiting for the results to confirm whether or not 2 people in Sydney have contracted the virus, and we're likely to hear of those results sometime this evening. Now, there are potential 7 cases in New South Wales, all people who have flown from China to Australia. Now, the 2 probable cases are men aged in their 30s and 50s. They're being held in isolation in 2 separate Sydney hospitals. Health officials are also urging people who believe they have the symptoms or believe they may have contracted the virus not to go straight to emergency departments without warning, but rather contact their GP or local hospital and get some advice. Georgie?
All right, Emma, thank you very much for that. Chris O'Keefe joins me now in the studio. And Chris, what steps has the government taken to prevent a widespread outbreak here?
Well, Georgie, every single health authority in the country is working from the same rules and procedures to ensure a national response. Today, the health ministers in all states had a phone hook-up to get everybody on the same page, and a crisis plan is now in place. Now, at the border, any flight from China will have passengers stopped. And there was one that landed into Sydney just after 1 o'clock this afternoon, and they were met by biosecurity officials and told what to do if they feel unwell. That advice is in English and Mandarin. Now, no planes will enter Australia from Wuhan, which is ground zero for the virus, but because it's now spreading faster than the SARS epidemic, Georgie, containing it is very, very difficult.
Indeed. All right. Thank you, Chris.